We've talked a lot today about false positives and the impact it has on mental health, et cetera, et cetera. But what about the false negatives? And I think they're two sides of the same coin, personally, that are showing us the holes in our healthcare system because of that lack. Either way, either none of those things should make me lose trust in the person taking care of me, except for there have been 1,000 tiny little cuts along the way that in that moment where you get it wrong, now I'm like, okay, I don't trust you, but I need you. So I'm going to treat you like the car mechanic that I can't afford to fix my ride. And you're going to fix what's wrong with me, but I may not be as sugary sweet about it as you want me to be, because I'm going to fight the whole way to get what I know I need, knowing that to you, I'm just another number that needs to be appreciated, which is not, that's not healthcare. I agree with the moderator. When do you stop thinking about mortality rates and start thinking about quality of life? I am one of those women that will do whatever it takes to find out that it's not cancer. But I feel like every woman should have that and not this defeatist attitude of they're just going to do what they're going to do anyways. Because where did that come from, except for the fact that that woman at some point in time in her healthcare journey encountered physicians that didn't treat her like she was human and just told her no, and that she was wrong about her own body. And
Yeah. And that is a product of systemic racism. And that is where we just really have to be clear because, what you said, like, I'm just thankful that for me, when I was diagnosed, when I went in I found a lump in my left breast. And I am so thankful that my human doctor did a mammogram and ultrasound on both breasts. Okay. And the lump, it was benign. It disappeared. It wasn't even the left breast. It was the right breast. I had cancer in 3 places because I had dense breasts. You would never have known that. I would have never known that I had stage 2A invasive ductal carcinoma, which even after I was diagnosed a few weeks later after I had my biopsy, it had spread into my lymph nodes.
also, it's not just the systemic racism, it's the bias that comes from being a patient advocate. Because that happened to me just recently. Oh, you're just over anxious because you're a breast cancer patient advocate. No, I'm over anxious because I'm sitting in front of you and I'm trying to communicate to you what it is I need. Tired of people surveilling things in my body that I don't want in there. Can you just, you want to watch it, take it out, put it in a cup, put it on your desk, and watch it from there. Do not watch it inside of my body because I want it
Right.
out.
We're talking about the cost factor, like um, not being able to afford the copay,
Mm-hmm.
things like that. They need to write a
Mm-hmm.
policy to waive that. A lot of people can't afford copays, especially if they have children and are single parents and are paying the that high amount for the best insurance that they can possibly have for their family, and a lot of times they take the cheaper rate out. And so, with
Mhm.
that being said, their copay is higher, and guess what? Their deductible and all of those things. So, how about we can waive that? Because what they're saying also, another thing is the doctors are saying that they're anxious in regards to the numbers, in regards to the fact that they've given out 128,793 mammograms to 62,185 patients. So that's 66,608 people. You're anxious because you're trying to figure, wait, because of the humanity factor. You're rushing a person's life expectancy. You are rushing. You know, if you can waive that, because apparently that's an issue with you too. Oh, they can't afford this. Why is that of your concern? So let's waive that. Let's set something up for that patient who comes in, and we all are aware. You know what I'm saying? That's a gift that everybody's given. So you're aware of that. So give them that information. Let's go ahead and fill out this paperwork. Come on in, girl, and get them tatas stretched and smashed, or whatever else you need to do. So that's something, it's the anxiousness over numbers. So it separates you because now you're not being human anymore because it's all about numbers.
How it's disseminated to the general public, policies that regulate when and how you share it, and then policies that regulate how it's shared within the medical community. So we don't have, I mean, the one advantage of having controversial meetings like this one is it makes those of us in the room who still have our humanity hat on underneath all of the other hats that we wear, it makes us go, okay, still got more work to do. Thank you for letting me know exactly how much work I have left to do. But at the same time, why does it have to be controversial? Why can't it be just a pure sharing of ideas? One medical professional, scientist to another, that you're all wearing your humanity hat. Like, it should be a requirement that if you can't translate the numbers into Jane Smith's everyday life and what impact it will have for the better or for the worse, then you can't share your research outside of an article. End of story.
We need more foot soldiers. So honestly, that's where I'm at on today, is reaching the ones that are being left behind. Because in a way, can I see a change coming? Yes, I do. There's always going to be a change coming. However, if you leave behind the people that are always being left behind, what change really is coming? Who is the change going to benefit? So yeah, change is coming. So it's up to us, Tiger Lily Angels, and the people that we represent. It's up for us to continue to do what we're doing. Because yeah, we are coming and we're sitting in this platform hearing these scientists and doctors who are very robotic. We need to continue to speak, raise our voice, and represent the change on behalf of the ones that are behind, and that's us. We're always left behind. So we need to connect these dots.
A lot of statistics that are being used to drive decision making. And what was left out of the decision making process that needs to be mixed with those statistics is your individual story as a patient advocate. What brought you to the office of that oncologist, either for yourself or for your loved one? Because what they explained was that a lot of things are changing, but they're changing based on numbers. Very few things are changing based off of the human patient experience. Even though they kept citing how important the patient experience is, but they cited it in an effort to downplay quality of life as an important endpoint. When quality of life is everything for the survivors, thrivers, and advocates that are walking the cancer road.
Everything that you're saying, it's like the quality of life. How, a lot of people don't know how to manage or prepare for the quality of life. And I'm so thankful that along the way, thanks to Tiger Lily, okay, because thanks to Tiger Lily opening my lens, I was a part of a clinical trial, Ayurveda study, to help me with understanding my physics naturally. Times to eat, things like that. Definitely drinking water. We need to be telling our patients, please drink water on all the time. Please, please, please. Stuff like that. All of those things, because it took a long time for me to get to where I am now. And that's with all the medications, all of the nights going through chemotherapy, not being able to sleep, the night sweats, being cold, having one side of the house, the heater off, the other side so my parents can be calm, but I'm over here dying while I'm trying to survive. All of those things, it's just so much to it. Having to get up, getting out the bed, having to just so many things, being backed up because of the medication and having to take stuff to bring that down because people do die from that.
Yes.
All
yes,
of those things. So people, the doctors, oh, but the cancer is leaving you. Oh, but so am I. It's also just reminding the patients that you're the boss. Remember that. Remember, the doctor works for you. Don't get it twisted. Don't get it twisted. And that's what I have to remind patients. And especially when I'm doing the trainings with the advocates, I'm telling them, remember, you are the boss.